Yeah, hi everyone. Welcome to my channel. My name is Dr. Wan, and I'm here today to answer some questions that some of my followers, patients, have been asking for quite some time now with regards to transplant. Diabetes type 1, most of the time, transplant is the best option to avoid taking medications for donkey years. So that's it. I know it's costly, but it's quite efficient if you fall within that age range. That should be the best option for you, because as we go older, the liver itself becomes compromised. So drug metabolism becomes a big issue. So that's why I want to make this clip in order to address this issue, because there have been lots of questioning with regards to this topic. So I will entitle it Frequently Asked Questions About Pancreas Transplants. So question number 1, am I a good candidate for a pancreas transplant? You will need a thorough evaluation by the transplant institution staff in consultation with referring physicians to determine if transplantation is the best treatment option. Being a good candidate for transplant depends upon your physical health, emotional well-being, and ability to manage medication and care plan, like I said before. So at a certain age range, the liver might not be good to tolerate such a situation. So I would say ages of 20, 25 to max 55. So that's it. You cannot get this thing at that, because when we get to 65, the organs now tend to shrink. There's what we call apoptosis. Apoptosis goes into full swing at that age range, so there's no point giving you a transplant. People with type 1 diabetes, in bracket, inability to produce insulin, chronic pancreatitis, or traumatic loss of pancreas may be candidates for pancreas transplant. However, those with type 2 diabetes, where the body is unable to use the insulin it produces, generally do not benefit from a pancreas transplant. So this is something that you need to know. The fact that you have diabetes doesn't guarantee you that you benefit from this. So certain conditions have to be met in order for you to go for it. So generally, type 1s have that, I call it precedence. Type 2 is not that doable, so that's it. The next question is, how will a pancreas transplant benefit me? One of the biggest benefits to a pancreas transplant for people with type 1 diabetes is lifestyle improvement. You will no longer need insulin injections, and you can enjoy a regular diet. Depending on your health before the transplant, you are also likely to experience greater independence and activity. Protection from kidney damage is the other significant benefit, because the new pancreas will help preventing high blood sugar from damaging your body. So that's one of the advantages that you have. So other than the pancreas, there's also the kidney that benefits from that. So that's the good news. It's kind of, I call it a win-win situation. Or yes, that's it. Or double, what you want to put it. The next question is, how soon after the pancreas transplant, can I stop taking insulin? This is a great question here. Following a successful pancreas transplant, your new organ will begin making insulin right away. Initially, some hospitalized patients may need to take low levels of insulin so as not to stress the newly transplanted donor pancreas. However, by the time most people are ready to go home, they are no longer taking insulin and they are able to enjoy a regular diet. I've just been diagnosed with type 1 diabetes. Will a pancreas transplant help reduce my risk of vascular disease, retinopathy, and other health concerns brought on by diabetes? That's another great question. And the answer here is yes. A pancreas transplant will help reduce your risk of vascular disease, but it will not reverse any vascular disease that is present at the time of your transplant. So get this point clear. It will prevent progression of retinopathy, that is a degenerative disease of the retina, and in some cases may reverse already established symptoms of the eye disease. So it's kind of, I would call this one downstream management of diabetes here, because we have upstream and downstream, which I'm going to make another clip to explain what is upstream management of diabetes and downstream management of diabetes. So this case of transplant is being considered as downstream management. So it helps to prevent further complication of existing conditions. Say when you have a cardiovascular disorder, in that case, it prevents it, but it doesn't stop it. So that thing doesn't go worse from what it's supposed to be. So that's the good news here. A pancreas transplant will also improve peripheral neuropathy, although strict sugar control will also reverse this condition. With peripheral neuropathy, injury to the peripheral nerves, which carry signal between the central nervous system, that is the spinal column and brain, and the internal organs, muscles and skin, can produce tingling, pain, and debilitation. The next question is, I have a mild case of diabetes that is easily controlled. Am I eligible for a pancreas transplant? And here you go with the answer. A pancreas transplant is generally not for patients who have a mild case of type 1 diabetes that responds well to insulin therapy and certain diet restrictions. So the way we handle diabetes here, like I said before in the other video, that diet is another one, physical activity is another one. The way the insulin receptors, they respond to the therapy, that's another one. So if those receptors have undergone what we call downregulation, then it's a different story here. But if they have not undergone downregulation, then it becomes totally a different story here. Some people consider transplant because they do not want to deal with certain lifestyle issues. For example, limitation in diet, monitoring blood levels, or needing 3 and 4 needle shots daily. So that's the whole thing here. Other patients consider pancreas transplant because they have brittle diabetes with very severe and sudden symptoms and complications from type 1 diabetes. These are people who have dangerous hypoglycemic unawareness. They pass out frequently because they are completely unaware that their blood sugar is getting low. Having one of these episodes while driving a car or sleeping can be life-threatening. So you see, these are the cases that you could be considered for this transplant if you find yourself in such a situation. Apart from regulating blood sugar, a new pancreas for this patient may protect against kidney disease and other long-term complications of diabetes. Some patients with diabetes who have already received a donor kidney consider pancreas transplantation to protect their new kidney from health complications from diabetes. So that's another thing, as I was saying before. We call this group of patients SPK. So SPK stands for simulation of pancreas and kidney. So that's the name we give to such patients. So we call, when you hear a medical doctor talk about SPK, then just know that that's what they're referring to. I will make another video to actually explain what is simultaneous pancreas and kidney. So, meaning that you are now using the two organs together. So, I'm just give you a short explanation, then we'll go back to the main thing. A simultaneous pancreas kidney transplant is a treatment for patients with kidney failure and insulin-dependent diabetes. The kidneys and pancreas are removed from a patient who has died or a deceased donor and given to the patient who needs it, that is the recipient. So that's what it is. So having said that, we go now to the next question. What are the benefits of pancreas after kidney transplant? So we call that one PAK. So PAK, P stands for pancreas, and A stands for after, and K stands for kidney. For certain patients with type 1 diabetes, research shows that pancreas after kidney, PAK transplantation, helps improve blood sugar control without the need for insulin injections, improve the longevity of the kidney transplant, prevent recurrent kidney disease brought on by diabetes in the transplanted kidney, stabilize and possibly reverse a number of diabetes-related conditions such as kidney disease, nerves dysfunction, and eye disease in some patients, and improve the overall quality of life. The next question, how do I get a pancreas? Patients who need a pancreas transplant are listed with United Network for Organ Sharing. So this is something an American or North American, but I believe that in your country of residence, there should be a different body responsible for that. So here in North America, we call it UNOS. So UNOS administers and maintains the National Organ Transplant Waiting List. So that's where you go and get it. The New England Organ Bank, called NEOPS, is the local regional procurement organization for Beth Israel Diaconal Medical Center and shares organs through UNOS. Staff at NEOPS will enter your medical information into a computer and will notify our transplant team when an organ becomes available based on your waiting time on the list, blood type, and other factors. All organs procurement organization and transplant institute will be arranged, and all this belongs to the units which I said before. The NUPS operates according to policies set by UNOS, which is supervised by the federal government. Donor pancreases from deceased individual or a precious national resource. The NERB, or call it NEOB, helps ensure equal access to all patients who need a pancreas for transplant by balancing the needs of patients who have waited a long time with the goal of transplanting well-matched pancreases. It is a complex procedure, as you all know. So a little bit of patience is needed here. So please talk to the Transplant Institute team if you have any other questions. I just give you the names and I'll provide the phone number as well for those living in North America. How long will I wait for, or will I wait on that list? How long will the name stay there? That's the whole thing here. When will you get this call? There's no guarantee when a deceased donor pancreas will be available. It could be a month or years. The average wait time for a deceased donor pancreas in New England is between 1 to 2 years. The waiting list is longer for patients with blood type O or type B, like I was saying. That's what we talk of. We talk of compatibility. And shorter for patients with blood type A or AB. If you need a simultaneous pancreas kidney transplant, what I was saying before, known as SPK, from the same disease donor, the wait time could be from 3 to 5 in terms of years. For this reason, we strongly advise patients to consider talking to family members, friends, and others about living kidney donation followed by a deceased donor pancreas transplant. Patients who have a living kidney donor may be able to avoid dialysis or may spend less time on dialysis than if they had to wait for a deceased donor kidney. This has a number of health benefits for the transplant patient. The next question, what medication must I take? You must always take a rejection medication for as long as you have a functioning transplant. You will also need medications to prevent infection for a short time after your transplant. Additionally, you may need at some point in time medications to control blood pressure and prevent fluid retention. You are responsible for managing your own medication schedule as determined by the Transplant Institute team. You should never stop taking your medication or change the dose without approval from the transplantation team, even if you experience unpleasant side effects. Tolerating some side effects temporarily may be necessary in order to prevent organ rejection. Tell your transplant team about any side effects that bothers you. Your doctor may be able to adjust your medication or medications. The next question here is, what is the success rate for pancreas transplantation? Pancreas transplant is successful in about 90% of patients who no longer have to take insulin injections within the first year following the surgery. After the first year, more than 2/3 of pancreas transplant recipients are still off insulin. The rate of organ function is very high, with a half-life of about 10 years. In other words, after 10 years, half of the transplanted pancreases are still working, which in terms of organ transplant is very good. Those that are still working typically go to work for many more years. Surgeons are hopeful that the success rate will climb even higher in the future because of ongoing improvements in medication that support the functioning of the transplanted pancreas. Now, the next one is, what if I reject the new pancreas? Rejection is a signal that the patient's immune system has identified the new pancreas as foreign tissue and is trying to get rid of it. Preventing rejection with immunosuppressant medication is the first priority here. The most common sign of rejection is change in pancreas function, that is, an elevation of pancreas enzymes and or glucose level as measured by blood tests. If the rejection episode is verified through blood work, biopsy, and ultrasound, then the transplant team will increase the amount of anti-rejection medication or prescribe a different combination of anti-rejection drug therapy. Using medicine, we can successfully reverse most rejection episodes if we detect it earlier enough. However, if the episode is severe, it may shorten the overall lifespan of the new pancreas. The next question, how often will I have to go into the transplant institute after my transplant? For the first 3 to 6 months after your transplant, you will have frequent follow-up visits with the transplant team and frequent laboratory tests. Gradually, however, you will see the transplant team less often. At this stage, you can look forward to having more time for yourself and your activity. You will become even more responsible for maintaining your own health. As you begin to see the transplant team less often, many of your health care visits will be to your primary care physician and or nephrologist, diabetologist, and other specialists are needed. Always tell your healthcare provider that you have had a transplant, so if you do become ill, they can determine whether your symptoms are or are not related to your transplant. We recommend you keep a list of your current medications as well as any drug allergies with you at all times. Do I have to follow a special diet after a pancreas transplant? That's another great question. Because of the medication you must take, transplant patients are more likely to be affected by germs that may be on or in food. You should wash all fruits and vegetables thoroughly before eating and avoid raw or uncooked meat, poultry, fish, sushi, raw shellfish, and raw eggs in any form, including cookies, donut, and eggnog. Also, you cannot have grapefruit juice or any juice, beverages containing grapefruit because they will interfere with your medication. Here is a very interesting part here because when we talk about the grapefruit juice, we are indirectly talking of pharmacogenetics or pharmacogenomics. That's the cytochrome P450 because they can now suppress that drug that you are currently using. So their efficiency will not be the same as they are supposed to be. So that's why your consumption of grapefruits or grapefruit juice are limited. So for those of you in Cameroon, we have what they call pamplemousse. So that's another a good example. Because you feel better with your new organ, your diet will be less restricted. Also, some medicine may increase appetite. Therefore, it is very important for you to follow a healthy diet to avoid gaining too much weight. That's another key point here. Weight management is a very important thing. The transplant team works with each patient to develop an individualized diet plan, taking into consideration special needs and restrictions. The next one, physical exercise. Can I exercise? The answer is yes. It will take time to regain strength and endurance after a transplant, but eventually you can resume normal activity. Walking and stair climbing are excellent exercises for maintaining muscle tone and strength. You should consider walking 5 to 10 minutes a day when you first arrive home following surgery, and then slowly increase the time you walk each week. Do not begin strenuous exercises such as contact sports, jogging, tennis, and weightlifting for at least 2 months after the operation. It is normal to tire easily, so you should rest when tired. The next question here is, are there any restrictions I must follow? You should not smoke, that one is guaranteed after transplant, and every attempt to quit prior to transplant is crucial to extend your life and the life of the new pancreas, because there's also this issue of waste elimination. So that one has to be taken into consideration. The transplant team will let you know when you can begin to drive again, return to work or school, and travel. You can decide when to resume sexual activity depending upon how you feel. Post-operative discomfort usually does not interrupt sexual activity for more than a few weeks. Next question, how do I pay for a transplant? The financial coordinator of the transplantation team, along with social worker, will help you map out financial plan to cover the costs associated with transplant cases, surgery, and medication. Patients typically finance costs associated with their transplant by combining more than one financial resources. There are several options for those who do not have any type of health coverage, and there are policies and laws designed to help transplant patients with special financial needs. The Transplant Institute social worker and financial counselor help develop a workable plan for each patient. Next question, what are my out-of-pocket costs after the transplant? Out-of-pocket costs following a transplant are highly variable based on whether you have insurance or whether you are eligible for Medicare or Medicare coverage. We understand the finances are a major concern for patients, and good planning will help to reduce the stress. Your financial counselor will review your own unique situation and help you on an individual basis address your financial concerns and available resources. Together, we can help you manage the financial impact of your illness, transplant surgery, and long-term recovery. So we've come to the end of question and answer session with regards to pancreas transplant. So please don't forget to subscribe to my YouTube channel, and feel free to ask me more questions if what I've done so far is not sufficient. If I've not answered the question to the best of my knowledge, please just let me know. My name is Dr. WAN, and share this video with all loved ones, and have a wonderful evening. Ciao.